afternoon. Please accept my apology again. No improvement in my French during the last 50 hours, but I promise to improve my French for the next hacking help. Okay. What we worked on this project during the last 50 hours, what was the problem? The problem is that always patients should decide to do the surgery or not to do the surgery, to do which type of treatment, and there are like different options, which one should I proceed with, and each of these options has its own consequences for the patient. So in the prenatal screening context, pregnant woman has a problem has a decision to make to undergo to the prenatal screening test for T21 or not to do it. If do it, there are some benefits and risks. If not, there are some other benefits and risks for her. And the only option apparently is that they go to the family doctor, they have some consultation, and then family doctor gives them a like 2-3 page decision aid, and in the decision making part, they should choose the main benefits. They should write like this. It's this part is from the decision making. They should define their own benefits and risks, and finally they should decide to do it or not to do it. But this decision making is not easy to make. So during these 50 hours, we try to find new methods in order to develop, in order to facilitate this decision-making procedure for them. There is a mathematical modeling called analytical hierarchy process. It's inspired by human mind that they have been used in politics, in economics, in logistics, manufacturing industries, but never been used for decision-making for patients. And it's based on the mathematics and psychology. So I didn't find health-related examples, so I give you an example of how this methodology works. For example, we want to decide a leader. There is 3 types of leaders, and the criteria that should be considered is experience, education, charisma, and age. So different leaders have different criteria, and finally they should choose one of the leaders. But it's not easy procedure, and this methodology, which is systematic and analytical methodology, put the problem as a hierarchy and then ask pairwise questions, and based on the responses, choose the final decision or final alternative. So inspired by this methodology, we designed our own hierarchy process for the decision-making for pregnant women problem. So the criteria is benefits and harms, and there are different benefits to do the test or not to do the test, and harms as well. This is the mathematical part that we worked on in order to design this decision-making procedure for the pregnant woman. And then we developed an app based on this developed methodology, which called Decide. This application is based on the patient's opinion, because we had a patient in our team. So we asked her whether she is comfortable with the design, and we designed this application based on patient's opinion, and also based on international patient decision aid standards. So this is the application. Okay. Well, at the first page, we start with the first page. We give enough information, basic information for the patient, that what are the risks and each option, what are the different information that patients should know, like like what is T21, what is the possible options, and then what is the benefits of doing the test, and what is the possible harms of doing the test or not doing the test. So this is the harm that not doing the test. So and then in this part, based on the patient will choose her own options for harms and benefits, and then we will have based on the chosen. It's too fast. Okay, based on the chosen decisions, the application will design the questionnaire, pairwise questionnaires for the pregnant women. And after that, we put a sure test. Sure test is a kind of test that has been developed by Dr. Legare in order to assure that patient made a good decision. So we put the sure test as the options over there. And at the end, the application will give like the final result will be like that patient can send the result directly by email to the family doctor in order to see the results. So this is the final page that shows based on patient's preference and values that like you 73% do the test and 27% not do the test. And what is the uncertainty in your decision based on the sure test? It's shown on the opposite side. So, we, during these 50 minutes, we did we developed a methodology for decision making inspired by manufacturing, by developed methodology in manufacturing industries and applied for decision making for patients. And the second thing, developing an app which is easy to use and designed based on patients. And what is the result? Is effective, informed, and high-quality decision-making.
All right, give a good round of applause for an application that really helps patients make decisions with a robust, scientific approach in tough situations of life. Well done, it's hard, eh? But nice demo. Questions?
How hard would it be to adapt to a different health situation? Do we have to completely reprogram or just change the questions?
Sorry,
How hard is it to apply what you did for T21 to another decision-making process in health?
It won't be that hard because the basic concept of the method is the same, but the only thing that will be changed is like the benefits and harms like the questionnaire that will be designed based on the benefits and harms based on different cases. For example, in this case, the alternatives were like doing the test or not doing the test. In another case, it could be do the surgery or not do the surgery. It's basically the same concept, but we just changed the how it shows, but the main concept is the same.
All right, applaudissez bien fort, mesdames et messieurs. C'était le dernier projet de ce hackathon inaugural, marathon de l'innovation ici à Québec.